Thomas Baldrick here at ASCO 2015 for Oncology TV, joined now by Dr. Thomas Aparacio from the Avicenne Hospital in France. Thanks for coming by.
Thanks to interview me.
So before we sat down, you told me your English isn't that good, and I said neither is mine, so we'll be perfect together, all right?
Okay, thank
you. All right. Let's talk about this Prodige 20 phase 2 trial. But before we do, can you talk about just the unique challenges that you have in working with patients 75 years and older?
Yeah, that's a real challenge because, as you know, geriatric oncology is a growing measures, and cancers are numerous in elderly patients, especially colorectal cancer. In France, the median age of colorectal cancer is 70, so it's a real matter of old patients. And with old patients, we have to deal with several problems, comorbidities, frailty, willingness to be treated. So it's not so easy an old patient is not so easy to treat than a young patient. And especially comorbidity, we have cardiovascular comorbidity, and this is a concern with the treatment with anti-angiogenic agents.
So tell us about the study and why you chose to do it.
The main objective of the study is to establish the benefits of an anti-angiogenic drug, the Bevacizumab, in colorectal cancer in elderly patients. As we have concern about cardiovascular disease, we decided to perform a study especially for elderly patients. This study is a randomized phase 2 study that includes 102 patients. And they were randomized in one arm with classical chemotherapy, 5-FU infusional or 5-FU plus irinotecan or oxaliplatin. And the investigator have the possibility to choose the type of chemotherapy that was adapted to the particular type of patients. If they are frail, they use monotherapy or 5-FU, and if they are fit with aggressive disease, they use a doublet therapy. And then the randomization concerned the Bevacizumab. This trial have an endpoint, a special endpoint. It was a composite endpoint. It is now more recommended for the specific study in geriatrician. This specific endpoint combine efficacy endpoint with the tumor control, and also the evaluation of quality of life and the safety as cardiovascular toxicities and unexpected hospitalization, as it is a real concern in elderly patients. So this trial is now finished, and we have the first preliminary results for the primary endpoint that was evaluated after 4 months after randomization. And we have the positive results in this study, as the experimental arm and the control arm are met the safety and the efficacy endpoints. But we have also secondary endpoints that were more traditional, as progression-free survival and overall survival. We don't present at this ASCO the definitive analysis for this endpoint, as the data are not mature, but the preliminary data show very good hazard ratio in favor of Bevacizumab arm for progression-free survival. It's a hazard ratio of 0.6, and for overall survival we have also an hazard ratio of 0.69. So we will present the final result, I hope, in 1 year. Moreover, we have performed geriatric evaluation with geriatric assessment in every patient at inclusion and every 2 months. And we show in the first results that the autonomy of the patients are correlated to the primary endpoint. And this will be checked further for the overall survival and progression-free survival. So we saw poor toxicity. There is not a lot of toxicity with Bevacizumab, so this study is positive.
So in terms of the data you have at ASCO 2015, what do you think the clinical implications are?
Oh, for the data we afford, we have a good safety and tolerability of bevacizumab in this population. And this is the first point, an important point. And the second data, it's that there is a progression-free survival expected significant, but this is not demonstrated at now, but will probably appear in the next evaluation.
Keep us updated when you get more information.
We will update the analysis in 6 months, so it could be deliverable in next ASCO or next ESMO.
Very good. Thank you, sir. We appreciate your time.
Thank you.